Vape Politics Radio, covering calls to action all around the country, breaking industry news, all things FDA, event coverage, and answering your questions here at home and abroad. Make sure you follow us on Facebook at facebook.vapepolitics.com and go over and give our Twitter a follow at twitter.vapepolitics.com. Hello, everybody, and welcome to Vape Politics Radio, Episode 4. This week's show will be bringing you some information from the United Kingdom, with some advocacy information coming from across the pond. We also have some information on the New York E-cig ban. We'll be talking about that shortly. Big tobacco fighting cancer. Yes, I will repeat that because it did sound completely crazy. Big tobacco fighting cancer. More information on that coming up soon. And our top story tonight is going to be Congress fighting against the FDA to protect the electronic cigarette industry as we know it today. Everything and more on Vape Politics Radio. Hello, everybody, and thank you for joining us. Our first segment is going to be some advocacy news from across the pond. According to nicotinepolicy.net, where Dr. Neil McKegney, who is the director of the Center for Drug Misuse Research over in Wales, he produced an article this past week about some stuff going on in the UK, and I'll read some excerpts from that. The recent announcement from health officials in Wales that the use of e-cigarettes in public spaces will be banned has received a mix of responses, ranging from enthusiasm, puzzlement, and downright dismay from the vaping community itself. The argument for such strident action seems to be that e-cigarettes are serving to renormalize smoking. For anybody seeking to promote evidence-based public policy, that anxiety and the interventionist public policy that flows from it must be a matter of enormous concern, since one looks in vain for the evidence of renormalization actually occurring. What they're saying here is that there's some legislation coming up in Wales that will ban e-cigarettes in public, and the reasoning for that, the reasoning that was provided, was that e-cigarettes are renormalizing smoking. And I will give that argument a tiny, tiny bit of credit. We are renormalizing the cultural aspect of smoking, which was 50 years ago, people would get together to smoke. The only difference now is we're getting together to vape. This has nothing to do with smoking. We are not smoking. We're using electronic cigarettes that produce no smoke. There's no combustion. It's a completely different thing. But what I think we are renormalizing is the cultural aspect and the community aspect. 50, 60 years ago, they were hosting cocktail parties in New York City where everybody was getting together to smoke, specifically to get together to smoke. Now, do we have events? Do we get together? Do we have groups? Yes. But does that renormalize smoking? No, I just think that we are reinstituting a part of culture that was lost, which was this joining together of a group of people. And that's what we are renormalizing, a togetherness. And I'm completely fine with that. It goes on to say, in this case, though, the policy being implemented is nothing short of perverse, since it is now widely accepted that whatever harm of e-cigarettes that there are, it is a great deal less harmful than smoking combustible tobacco. As a result, public health officials in Wales find themselves announcing a ban that in the long term may well increase, not decrease, the harm from smoking through impeding individuals' access to what many millions of smokers are seeing as their preferred means of stopping smoking in general. In a country where there are no shortages of environmental pollutants exerting a terrible toll on public health, it is slightly bizarre that the Royal Environmental Health Institute for Scotland has called for a similar ban to be proposed on the use of e-cigarettes. So it seems that it's kind of flipping in the UK. Last week we had really great news, which was that 25% of all United Kingdom smokers have converted to vaping. You would think that their community would be talking about this. I checked some of the UK vape pages and I haven't seen anything. Obviously, we shared this article on Vape Politics. We wrote our own, and we pushed it out there, and we've reached over 1,500 people. I'm hoping that some people in the UK are seeing this and sharing it with their friends and vapers in their area. But this is information that they need to see because there needs to be more of an uproar about this. You have to fight against these blanket bans. If e-cigarettes turn out to be associated with some level of long-term harm, then those same public health officials will likely pat themselves on their collective backs, loudly proclaiming their actions. However, there may be a more immediate consequence of their actions that will provide no cause for celebration. We know that smoking kills smokers, and that e-cigarettes are being used as a way of reducing smoking. That being the case, in the event that this ban leads to a reduction in the numbers of those using e-cigarettes in Wales, we may see a slowing down in the rates of smoking cessation and an increase in tobacco-related health harm. It's not good news, but it's also not terrible news because we caught this before it's all going through. I commend Dr. Neil from the Center of Drug Misuse Research in the UK for publishing this and putting it out there. We need to be more aware of what's going on worldwide because it does affect us. Here in the States, we worry about the FDA and we worry about deeming regulations and how the government is going to react. We'll be talking about that further down the road in this episode. Congress is actually going up against the FDA on our behalf, believe it or not. We'll be discussing that further. But we need to be focused not only on our battles here at home, but our battles across the sea and everywhere else in the world, because even if we win our battle here, if there are still smokers dying worldwide, we haven't won. So that's something to think about. Now, considering the statistic that I brought up earlier, 25% of all UK smokers have converted to vaping. So what do you guys think? Do you think that their community should be more vocal? You can tell us in the comments below, and we're going to move on to our next section. All right, guys, our second story today is going to be some legislative news out of the state of New York. According to the Times-Union, a coalition of health-related groups have ignited a last-minute end-of-session push for legislation that would apply the Clean Indoor Air Act to electronic cigarettes. That means that vaping devices wouldn't be allowed in workplaces, including restaurants, bars, and even bowling alleys. It is unclear if the bill is on tap in the Senate, but it's still on the debate list for the Assembly for Thursday. And with the legislative session, which was supposed to end on Wednesday, likely to run into Friday and maybe even next week, there could be time to debate a number of measures like this, which would have been smoldering along for the past few months. There is a twist here as well, which centers on the role of convenience stores and grocery stores. As currently configured, this bill exempts convenience and grocery stores from the tobacco control rules that include periodic checks by the Department of Health to ensure that they aren't selling to minors. The bill was supposedly written that way to deflect what proponents believed might have been opposition by convenience stores. The trouble is, the convenience stores would rather have that oversight. That's because they are already under nearly identical oversight because they sell traditional cigarettes. But under the current proposal, independent freestanding vape shops that only sell smokeless cigarettes, or e-cigarettes, wouldn't have the Department of Health oversight, unless something is expressly put into law. The initial version would have had all e-cigarette vendors follow the inspection regime, but it was jettisoned, meaning that according to a convenience store memo on the bill, since only registered retailers get inspected, nobody's monitoring the vape shops. Again, that's because convenience and grocery stores already are registered because they sell traditional cigarettes. Here are the letters that the e-cigarette opponents have written to the legislative leaders, and all those links will be in the description below. Now, New York is already in some hot water legislative-wise when it comes to e-cigarettes. They're one of the most strict in the United States. What interests me is that the way this is worded, it's almost as if none of this is already in law, when it's already in law, and I'll put the link to the bill in the description below, but it's already in the law in New York that you cannot vape in public. You'll get cited for vaping. Russ Wishart talked about that last year when it happened. Anyway, moving forward, I just thought that was interesting. All the links will be in the description below. So what do you guys think? Should convenience stores and grocery stores be tattletaling on the vape shops, or should everybody register up? I don't see a huge problem with vape shops being registered. I do see a huge problem with them telling vape shops exactly what they can do and what they cannot do, because oversight and overreach are different things. But I digress. What do you guys think? Let us know in the comments below, and we're going to move on to our next segment. something that you may find interesting. Scientists are joining tobacco companies to fight cancer. Yes, I will repeat that because it is a bit puzzling. Scientists are joining tobacco companies to fight cancer. According to BusinessInsider.com, scientists who have devoted years developing medicines to cure disease are now working for tobacco companies to make e-cigarettes. Philip Morris International Incorporated has hired more than 400 scientists and technical staff at its research facility in Switzerland, including toxicologists, chemists, biologists, biostatisticians, and regulatory affairs experts. Altria Group Incorporated, makers of Marlboro, have recruited dozens of scientific and healthcare experts, as have independent e-cigarette companies such as Enjoy. They bring experience developing inhalation devices and navigating the U.S. Food and Drug Administration, valuable knowledge in the new world of electronic cigarettes. They say they're trying to improve public health. And I quote, "We were looking at drugs that make people very ill and maybe extend their life by 12 to 14 weeks, said Giselle Baker, a PMI biostatistician based in Neuchâtel, Switzerland, who previously worked at the cancer drug developer Poniard Pharmaceuticals. She goes on to say, if you have a product that prevents cancer in the first place, you can have a much bigger impact on public health. End quote. The goal is to improve the current generation of e-cigarettes and, where possible, provide evidence that they reduce the risk of disease. Companies that succeed could have an advantage in a market that Bonnie Herzog, an analyst at Wells Fargo Securities, sees surpassing combustible cigarettes in the U.S. within the next decade. Products declared reduced risk by the FDA could be treated with a lighter regulatory hand. And I quote, if tobacco companies can prove there is reduced risk, e-cigs are likely to remain less regulated in tax than cigarettes, said Philip Gorman, an analyst at Morningstar who views PMI as leading the way in the industry. Quote, if they can't, they will likely be subject to the same restrictions, end quote. All right, let's just take a moment here. Are open vapor systems and the small business to medium-sized business industry that we know as the vaping industry mentioned anywhere in here? What about our science? Business Insider seems to be taking a one-sided look at things. However, I do commend, and I say this very, very carefully, I commend Marlboro on hiring these scientists to take a look at e-cigarettes. Do I think that they have an agenda? Of course I do. Do I think that their results are going to be one-sided? Yes, I do. But that is my opinion. What do you guys think on this new wave of the tobacco companies fighting cancer? Because I'm pretty sure that's what we've been doing since the industry bumped up in 2009. I want to hear your thoughts. Let us know in the comments below, and the link for this article from Business Insider will be in the description. We'll move on to our next section. Some big breaking news coming from JournalNow.com. House subcommittee decision could limit money to regulate electronic cigarettes. Now, this story broke a few days ago, but it has been buzzing all around the community, gaining interest from people like Dimitri the Vaping Greek, P. Basardo, and tons of others throughout the industry, pushing this article everywhere, especially from Greg Connolly and the AVA. They were the first to break this story in our industry, and I will be reading from the Journal Now article that talks about this. A U.S. House Appropriations Subcommittee has recommended withholding funding that would help regulators tighten restrictions of tobacco product innovations such as electronic cigarettes. The Subcommittee of Agriculture, Rural Development, Food and Drug Administration, and related agencies addressed the selection of February 15, 2007 as the grandfather date for innovations. The recommendation goes to the full Appropriations Committee next week. As part of the Tobacco Control Act, FDA officials want new and enhanced products to be substantially equivalent to products already in the marketplace as of February 15th, 2007. Now, what this means, the grandfather date is something that has been discussed many, many times in our industry, especially since the FDA finally released what it would be, which is February 15th, 2007. Now, let me ask you a question. Were you a vapor before February 15th, 2007? Now, let's just pretend that you were not. Now, I know for a large majority of you, the answer is going to be no, I was not a vapor before February 15th, 2007. Now, let me backtrack you all the way down to your very first e-cig. Now, for veteran vapors, of which I am one, my very first e-cig was an 808 rechargeable battery and a cartomizer. Now, we also had bridged atomizers, and then later we had cardos that could go on egos and so on and so forth until we get to today. But what I started on was not something that existed before February 15th, 2007. And I think it's safe to say that most everybody started on something post February 15th, 2007. Now, what the grandfather date from the FDA is saying is that every single device, every single e-liquid, every single piece, part, and ploy of our industry that has been developed since that date will have to be strictly regulated, meaning every nicotine strength, every flavor, every bottle, every battery, every mod will have to go through a review process where each and every piece and product will have to be reviewed separately, which could take 6 months to a year to longer depending on the review. Now, this will take a long time per product, per item. And not only that, but it will take a lot of money. Now, I'm not a FDA analyst. I don't know how much exactly it is going to cost. We'll have that information soon, unfortunately, but it is going to cost a lot of money. Can you imagine having 10 e-liquids? Let's just use 10 e-liquids. Now, each e-liquid in each bottle size, in each nicotine strength will have to be sent off for separate review. Let's just call it $5,000 per review. Now, it's going to be more than that, but let's just call it $5,000 per review. That is an astronomical amount of money to get 10 flavors of e-liquid tested, reviewed, run through. And that doesn't even guarantee that it makes it back to market. They could deny it, say no, and you're out your money and your product. Now, what's going to happen here is Congress, more specifically, this subcommittee is going to withhold funding so that the FDA can't do this unless they change the grandfather date. I'm going to continue reading here. The FDA defines substantial equivalent or deemed as being the same in terms of ingredients, design, composition, heating source, and other characteristics to an existing single predicate product or have different characteristics but not raise different questions of public health. Given there were few innovative tobacco products in the marketplace in February 2007, manufacturers would have to go through more testing requirements. Some industry observers believe such restrictions would drastically curtail product innovations in e-cigs, as well as snus and the next generation of heat-not-burn traditional cigarettes, such as the Revo by R.J. Reynolds Tobacco Company. And I quote, "This is a sidestep around those regulations, instead of the Cole bill, which would directly amend it or just revoke the law itself," said Gilbert Ross, medical and executive director of the Pro-Business American Council on Science and Health. House Bill 2058, which is the legislation in question, introduced April 28th by Representative Tom Cole, a representative from Oklahoma, would change the grandfather date from February 15th, 2007 to 21 months after the effective date of the final FDA regulatory rule, meaning that once the regulations are out and published and official, we would have 21 months of innovation before we started having to send off new products to be reviewed. The FDA could issue its final regulatory rule any day, according to the industry officials. And I quote, "Should the agency choose not to alter the date, it will make it costly and create significant barriers for the industry and the FDA to bring innovative new products that may significantly reduce the harms associated with tobacco to market, and could force the withdrawal of many products that have come to market since February 2007, end quote, Cole said while presenting his bill. Now, that's exactly what I was talking about a moment ago when we discussed what was your first e-cig, because a very, very large majority of us started on something post-February 2007, and if this were to go the way that the FDA wants it to go, all of those products would be null and void and they would be gone. We wouldn't be able to buy any of it anymore. Every e-liquid company that's popped up in the last 5 years, gone. Every innovative product that's been coming into the United States, gone. No more Kangertech, no more Anakin, because yes, they're being produced in China, but they can't come into the States if they're not approved by the FDA. That gets into a whole nother can of worms. We're going to continue. And I quote, "The end result will be that newly deemed tobacco products would be treated much more harshly than immediately regulated products. The industry is largely unregulated in the absence of FDA e-cig regulations, except for the recommendations in April of 2014 to ban sales to those under age of 18, to require health warning labels, and to require an FDA review for existing and future products. The FDA did not call for an outright ban of e-cigs, which some anti-tobacco advocates had pushed for. The agency did not curtail internet sales or current marketing efforts that include television and social media. Other tobacco products subject to regulations are cigars, pipe tobacco, nicotine gels, water pipe, or hookah tobacco. Harold Wimmer, president and chief executive of the American Lung Association, said his group is, and I quote, deeply disappointed that the subcommittee would target FDA funding. All right, rant warning. I'm not going to go crazy right now, but I will say the same thing that Greg Connolly has been saying for years. The American Lung Association is wrong. That's all I'm going to say. I'm not going to poke holes at their character. I'm not going to poke holes at their leadership. All I'm going to say is that the American Vaping Association, and I'm taking this sentence directly from Greg Connolly, the American Vaping Association has never taken a dime from big tobacco or pharmaceutical companies. Unfortunately, the same cannot be said of the American Lung Association. That is all I'm going to say. But it just irks me. It pushes my buttons when the leader of the American Lung Association says that he is deeply, deeply disappointed that the subcommittee would target FDA funding. Well, yeah, Congress is going to target FDA funding because at least they understand that if you were to put the grandfather date as it is, February 2007, the industry dies. Over thousands and thousands of workers would lose their jobs. Tons of small and medium-sized businesses would immediately just drop off the face of the planet. It would be an economic crisis. Would it be a large economic crisis? Maybe not, but it would be noticeable. It would be bad. Moving forward, and I quote, this provision would significantly weaken the FDA's authority over these unregulated tobacco products, said Wimmer. This provision shows that some in Congress are still willing to prioritize big tobacco over the health of our nation, particularly young people who will become the next generations of smokers and tobacco users. That's all within Harold Wimmer's statement, and he is the president and chief executive of the American Lung Association. Now, how can a organization so large and with so much reach and resource and influence not know that vaping is not adding on to youth smoking, it's detracting? How can an organization this large not know that vaping is saving lives? I thought that's what the American Lung Association was supposed to do. I thought they were supposed to save lives. Now, I could be wrong, but it seems that what they're saying is that e-cigs are way more detrimental to public health than they are benefiting. Now, I just ask one question. Where is the evidence? American Lung Association, produce your evidence. That is all I ask, and that is the end of the rant. The GOP leaders asked the FDA officials to allow more than 7.5 years of product innovation and enhancements to be grandfathered in from February 15th, 2007 to April 25th, 2014 from potential oversight regulations. The April 25th, 2014 date is when the FDA released its latest but limited alternative tobacco product regulations. And I quote, "We have concerns that the proposed rules grandfather date will impede innovation and impose unnecessary regulatory burdens on both the FDA and regulated industries," according to the letter sent by House Majority Leader Kevin McCarthy and Representative Fred Upton. Analysts say that the surge in popularity in e-cigs over the past 6 years likely eliminated banning as an option, bearing new scientific proof of increased consumer danger from inhaling the vapor produced from an e-cig. E-cig manufacturers and marketers warned about an unregulated black market surfacing upon a ban. And I think that's true. I think we know that's true. A black market would emerge. I've had serious conversations with some very influential people in our industry, and I said, what happens if it all goes away? And the answer that I've received from most is that it doesn't go away. It just goes underground. And I quote, "Under the FDA's proposal, all e-cigarettes and cigars currently on the market would remain available as long as they filed an application with the FDA within 2 years," end quote, the coalition said. Continuing the quote, "During this time, companies could also introduce new products. These products would stay on the market until the FDA completes its review." Now, that's some tricky wording right there. Basically, what it's saying is that under the FDA's proposal, all e-cigarettes currently on the market would remain available as long as they filed an application within 2 years. Now, the FDA is not a very fast-working organization. Not to say that they're not effective, they are. They're not very fast. So 2 years is not a whole lot of time when it comes to what we're talking about here. Continuing, e-cigarette companies being targeted by these highly expensive, time-consuming, and especially baseless regulatory structures will find that their innovation development stifles during whatever interval is actually provided for this hiatus, said Ross. And I quote, "They cannot afford to wait for the FDA to issue them permits to go on developing, producing, and marketing their life-saving products," Ross said. The FDA is even now backed up with hundreds of thousands of significant equivalent applications, and they have shown a very strong proclivity towards denying those that they have finally ruled on, in quotes. Now, that's a lot of information to take in. Basically what's going on, and I'll give you the recap real quick. There's a subcommittee in Congress that deals with FDA funding. This subcommittee has realized that if the grandfather date that the FDA has produced, which is February 2007, is put into effect, our industry will be crippled. And they understand that, and they are doing the political dance of, we will cut funding if you do not push the date out to protect this industry. Now, how that's going to go, and that remains to be seen, but we will see something very, very soon. We will be keeping you updated this upcoming week on this big story. Make sure to watch our Facebook page at facebook.vapepolitics.com and Twitter at twitter.vapepolitics.com for more information, because I will be following this story very, very closely. Now, I want to hear what you think. Is this the right step? Is this where the battle lines are drawn? Because I think what we're seeing is the David and Goliath battle that we've been in for so long with the FDA finally coming to a head, and I'm very, very interested to see how it ends. Now, just let us know what you think in the comments below. Well, everybody, that's going to do it for this week's episode. Make sure to join in on all the conversations on our Facebook and our Twitter, and head over to our website at www.vapepolitics.com to keep up with our blog and find links to our older episodes. For everyone here at Vape Politics, this is Noah Richardson, signing off.